My name is Don Ortman. I'm from Rock Valley, Iowa, located in the northwest corner of the state, and I am an elementary principal. And I have about 400 students and families that I work with at Rock Valley Elementary. And it was because of those students is why I became involved with the Community Health Center. I had students and family members that had medical needs and dental needs that weren't being able to be met. They didn't have the finances and were struggling to get services that they needed that was affecting their education and their family life. And I was asked to be part of a steering committee about 8 years ago to investigate starting a community health center in our area. And that got me started on this journey with community health centers. It's kind of an interesting story. It was head lice. And we had a family, and they had very severe head lice. And they also had, it was two little girls with the cutest blonde curly hair. And they also had a little brother at home who was unable, who had a lot of medical issues. And so they had bills at the local clinic that they were unable to pay because of the little brother's issues. And so these two little girls then could not get the prescription shampoo they needed to get rid of the head lice. And while I was dealing with that and trying to get donations to get that taken care of and get their hospital bill paid up, a group of people came to me with a concern about not meeting the medical needs of people in our area. And I was heavy into head lice, and I said, you bet, count me in. I would love to help people be able to get the medical care, whether they're able to pay or not able to pay, to help other people. We have just recently been able to add some dental services to our program here, and there is such a demand. I have a good friend who is a local dentist in the area, and he says almost every single day he gets telephone calls from Medicaid patients trying to get into his dental clinic. And he's maxed out at the level of Medicaid patients he can take. We know here at the clinic we've had people stop in that have never been to a dentist in 30 years and are so thankful to get those services. Our problem here is being able to find people to staff those positions and fill those positions and be able to provide the funding to pay for those positions. We know that if we had our dental clinic open every day of the week, that we would be booked solid. There's a huge waiting list to get into our dental services, and it's a big need in the area. As a patient, you get to see the care that's being delivered here, and that's the thing that I see that we hear over and over. It's about the patient care here that people are receiving, and the care I have received here has been excellent. But what I hear from the most people are pregnant mothers. And we hear from pregnant mothers all over the area. In fact, it's a huge growing population here at the Community Health Center for us. Our pregnant mothers feel like they are being listened to, that their prenatal needs are being met, that our midwives and our physician's assistants take the time to go through the process that they need to go through to feel comfortable in developing their baby so that baby is born very healthy. The Community Health Center gives people hope. It gives people hope that they can be healthy. I've seen it change lives. We've had children come in here that have cleft foot at the age of 5 that no one has caught yet. We've been able to get those people services, and to the Shriners Hospital get services. We've had people that with weight loss and smoking cessation programs that have been very successful. And it's a place where people are able to get their medical needs met before they become very severe and cause problems where people are having to go to the emergency rooms or are having problems that are developing so far that their health is in such serious condition. So it's a very preventative system.